What is sickle cell anemia? It is a genetic blood disorder caused by abnormal red blood cells due to a gene mutation in beta-globin chain of hemoglobin. The HBB gene called hemoglobin subunit beta, present on chromosome number 11 at locus P15.5, provides instructions for making the beta-globin protein, a component of hemoglobin found in red blood cells. So it is an autosomal trait, not sex linked, and can equally spread in men and women. In this mutation, glutamic acid in normal chain is replaced by valine at 6th position during beta-globin translation, which enhances polymerization of hemoglobin molecules to form long chains, which result in sickle or crescent shape of red blood cells. This sickle shape produces many problems in normal blood flow in capillaries, and hence the disease is called sickle cell. The word anemia means the sickle shaped cells lose the normal capability to perform what normal cells do and has short lifespan, causing blood or hemoglobin deficiency, and overall performance of blood is low. That's why it is called anemia. Now, if we talk about inheritance pattern, then it is an autosomal recessive trait, which means both alleles of homologous pair are mutated, then individual will be affected. And if someone receive only one of the two alleles, then he/she will be carrier of disease. For instance, if a carrier man marries a carrier woman, then how much of their sons and daughters will be affected by sickle cell anemia? To solve this, let's draw a simple cross. A carrier is usually shown by HBB-HBS combination, or the abbreviation may vary but concept is same. When gametes will form, they will receive only one of the allele as per Mendel's law of segregation. Now these gametes have equal opportunities to combine with any of other to form zygote. So all possible combinations of next generation are HBB-HBB, which is normal daughter, HBB-HBS carrier son, HBS-HBB is carrier daughter, and HBS-HBS is affected son. In this way, it can be predicted for other marriages based on parents' genetics. Now we understood all the genetics of sickle cell anemia. Let's compare between a normal hemoglobin RBC and a sickled RBC. This comparison will help you further deepen your concept to understand. Number 1. Normal RBCs are round, disc-like cells, while sickle cell anemia cells have a characteristic crescent or sickle shape. Number 2. Normal RBCs are highly flexible, allowing them to easily move through narrow blood vessels, while sickle cell anemia cells are rigid and less flexible, leading to difficulties in passing through blood vessels. Number 3. Normal RBCs have a lifespan of approximately 128 days, while sickle cell anemia cells have a significantly shorter lifespan, usually around 10 to 20 days only. Number 4. Normal RBCs contain hemoglobin A, which efficiently binds with oxygen. In contrast, sickle cell anemia cells contain abnormal hemoglobin S, which can polymerize and cause the cell to deform under certain conditions. Number 5. Sickle cell anemia cells tend to clump together, causing blockages in blood vessels, reducing blood flow and leading to tissue damage and pain. Number 6. Both normal and sickle cell anemia cells carry oxygen, but sickle cell have a reduced oxygen carrying capacity due to their abnormal shape and reduced ability to bind to oxygen. Number 7. The spleen is responsible for filtering and removing damaged RBCs from circulation. In sickle cell anemia, the spleen can become enlarged and dysfunctional due to breakdown of sickle cells, leading to increased susceptibility to infections. Number 8. The abnormal shape and reduced lifespan of sickle cells can lead to damage in various organs, particularly the spleen, liver, bones, and kidneys. This comparison is very important to remember for you. Now let's talk about some signs and symptoms which help to diagnose whether someone has sickle cell anemia or not. Number 1. Fatigue. Sickle cells have a reduced lifespan, leading to a lower number of circulating RBCs, causing anemia. Anemia results in reduced oxygen delivery to tissues, leading to fatigue and weakness. Pain. Sickle cells can become stuck in small blood vessels, leading to blockages and reduced blood flow. These blockages can cause episodes of severe pain known as sickle cell crisis. Pain can occur in bones, chest, abdomen, and joints. Number 3. Jaundice. Sickle cells are fragile and easily break apart, releasing hemoglobin. The breakdown of hemoglobin results in an excess of bilirubin, leading to jaundice, which causes a yellowish discoloration of the skin and eyes. Number 4. Swelling of hands and feet. Blocked blood flow can lead to swelling in the hands and feet, particularly in young children with sickle cell anemia. Number 5. Enlarged spleen. Sickle cells can become trapped and destroyed in the spleen, leading to its enlargement. Number 6. Vision problems. Sickle cells can block blood vessels in the eye, leading to vision problems and potentially causing retinal damage. Number 7. Leg ulcers. Sickle cells can cause damage to the skin, leading to the formation of painful ulcers, usually on the legs. Number 8. Delayed growth and development. Chronic anemia and reduced oxygen supply can impair growth and development in children with sickle cell anemia. Now, it is sad to share here that there is currently no cure for sickle cell anemia, but various treatment options are available to overcome symptoms and reduce the frequency and severity of complications. The treatment approach can vary depending on the individual's age, severity of the condition, and specific symptoms. Here are some main treatment options. Number 1. Pain management. Pain is a common symptom of sickle cell anemia, especially during vaso-occlusive crisis. Pain can be managed with over-the-counter pain relievers such as acetaminophen or stronger prescription pain medication like opioids. Intravenous fluids and heat therapy may also be used to alleviate pain. Hydroxyurea. This medication is commonly used in adults with sickle cell anemia. Hydroxyurea helps increase the production of fetal hemoglobin, a type of hemoglobin that prevents sickling of red blood cells. Number 3. Blood transfusions. Regular blood transfusions can help increase the number of healthy red blood cells and reduce the number of sickle cells in circulation. Number 4. Hematopoietic stem cell transplant, which is also called bone marrow transplant. This is potentially curative treatment for sickle cell anemia, and it involves replacing the patient's bone marrow with healthy donor stem cells that produce normal hemoglobin. However, this procedure is risky and typically reserved for severe cases in younger patients. Number 5. Gene therapy. It involves modifying the patient's own stem cells outside the body and then transplanting them back into the patient. This field is still under research and development. 6. Antibiotics and vaccinations. While sickle cell anemia patients are more susceptible to infections, particularly in early childhood, regular vaccinations such as pneumococcal and influenza vaccines and prophylactic antibiotics can help prevent infections. Oxygen therapy. In some cases, supplemental oxygen may be administered during acute crisis to improve oxygen levels in the blood and tissues. Number 8. Folic acid supplements. Folic acid is essential for red blood cell production. Sickle cell anemia patients often have an increased turnover of red blood cells, and supplementation with folic acid helps support red blood cell production. Now, it's important to consult with a qualified healthcare professional to determine the most suitable treatment plan for an individual with sickle cell anemia, as each case can be unique in its presentation and requirement. Thanks for pressing the like button.